hospital authority revealed that an uncommon case of a false positive result and an inaccurate medical image were the reasons behind an incident in which a feeding tube being inserted into a patient's airway in Queen Elizabeth Hospital and left undetected in June. The 61-year-old male patient remained in critical condition and is still under intensive care. According to Tang Kam-sheng, president of the root cause analysis panel, the trainee doctor in charge at that time made a wrong judgment whether the tube was in the right place, which led the nurses to mistakenly feed the patient formula milk into his chest area, worsening his condition.
In this case, because the chest X-ray doesn't show clearly the tube of the nasogastric tube, we think that the doctor involved probably doesn't have enough clinical experience to make sure that the nasogastric tube is indeed in the correct space.
However, the authority believed the two nurses feeding the patient were following standard procedures. Tang explained that since the human stomach is acid, the way to determine if a nasogastric tube is inserted correctly is to test the pH level of the fluid from the tube. Unfortunately, the nurses tested the fluid from the patient's pleural space, which was infected due to long hospitalization, causing the results to be acidic.
When the nasogastric tube was put in the pleural space, what the nurses, when they are trying to verify the position, aspirate out is probably from the pleural space. And because it is infected, then it is acidic and showing a pH of less than 5.5. That's what we mean by false positive.
The authority gave recommendations to ensure proper X-ray confirmation of nasogastric tube placement, especially for high-risk patients, and to enhance supervision and training of junior doctors to prevent such incidents from happening again in the future. Jeremy Zhu, Cable News.